Hi everyone, my name is Olivia Umeda. Thank you very much for joining me today to talk a little bit about music therapy in medical settings, both pediatric and adults. So in medical settings, music therapy could be seen in many different units. This could include intensive care, emergency care, neurology, intermediate care, orthopedics, oncology, palliative care, pediatrics, rehabilitation, radiology, surgery, and more. Let's start off with our pediatric hospital settings. So in pediatric hospitals, music therapy closely follows a family-centered care model. And in this, there are 4 tenets. First, people are treated with dignity and respect. 2, healthcare providers communicate and share complete and unbiased information with patients and families in a way that is affirming and useful. 3, patients and family members build on their strengths by participating in experiences that enhance control and independence. And 4, collaboration among patients, family members, and providers occurs in policy and program development and professional education, as well as in the delivery of care. Let's take a look at the neonatal intensive care unit. So first, let's look at the common goals. First, music therapy can support sensory and neurobehavioral system development, and music therapy can improve developmental competence across many domains, such as the social, emotional, cognitive, communication, and motor domains. Music therapy can also increase opportunities for culturally sensitive parent-infant interactions in a developmentally appropriate manner. In terms of music therapy interventions that are used, first of all, there are individual sustained music, and this could be both live or recorded. There's music and multimodal stimulation, and this is a standardized technique in NICU music therapy. There's multisensory stimulation with live singing, and this is an adaptation of the music and multimodal stimulation technique that doesn't involve taking the infant out of the bedside. And sensory stimulation is provided in a variety of forms depending on the infant's stability and self-regulatory responses. There's prescriptive recorded music listening and developmental interventions. These in particular are for older or full-term infants that are deemed appropriate through developmental assessment. There's also low stimulus humming, and in this, it progresses from humming to singing at the bedside with no other stimulation. There's environmental music therapy. This incorporates sounds that exist within the NICU environment in the musical themes performed by a board-certified music therapist, and infants have to be continuously monitored throughout this intervention with strict consideration for the use of the musical elements such as timbre and harmony. It's also therapist vocal support recordings, where the music therapist records the singing voice to support the parent singing at bedside, and family vocal recordings, where siblings and parents are given materials and directions to make vocal recordings to leave at the bedside when they aren't able to be present. And music as a controlled motion is when music creates a soothing motion through the phrasing that creates homeostasis for the infant in a short period of time. And this uses the principle of entrainment. And entrainment is the process where 2 rhythms interact in such a way that they adjust and eventually gain matching periodicity. So now let's look at the pediatric intensive care unit. Some common characteristics that you would see here are cardiovascular system, such as shock and cardiovascular disease, respiratory system, such as severe asthma or respiratory failure, hematology or oncology, such as complications due to a disease or disorder, neurologic, like traumatic brain injuries or progressive neuromuscular dysfunction, gastrointestinal, such as severe gastrointestinal bleeding, endocrine or metabolic, such as electrolyte abnormalities, renal system, such as renal insufficiency or failure, surgical or major surgeries, multi-organ system failure, such as electrical injuries. And some common goal areas you see are to decrease anxiety, promote relaxation and decrease combativeness or agitation, decrease pain perception, improve sensory stimulation, improve cognition, decrease depression, improve therapeutic environment, this is especially seen in palliative care, improve range of motion, increase family support, normalize family interactions. Let's look at pediatric, medical, and surgical. So, in this setting, music therapy can be seen in either individual or group sessions. In individual sessions, the main goals are to decrease anxiety, decrease depression, decrease the perception of pain, provide multisensory stimulation, maintain fine and gross motor skills, and improve relaxation. With group sessions, the main goals are to improve socialization, provide educational opportunities, provide an emotional outlet, maintain gross or fine motor skills, or increase opportunities for autonomy. In the hematology, oncology, and bone marrow transplant, music therapists can also treat clients or patients here. So some common goal areas are to decrease the perception of pain, decrease anxiety, provide opportunities for autonomy, encourage emotional expression, provide normalization, improve communication, improve self-esteem, improve family integration, provide opportunities for social interaction, improve mood, provide comfort, offer daily support, provide multisensory stimulation, decrease developmental delay, reinforce academic skills. And some common interventions you could see are music listening, active music making, such as instrument play and singing, music-assisted relaxation, music as an alternate engagement for medical procedures, music-facilitated dramatic play, music permanent product, or music with movement. Music therapists also visit patients in burn recovery units. And there are three main phases in burn recovery that have different goals. In the acute phase, this works on improving coping skills related to pain, trauma, and anxiety, improving positive guardian or parent and family interactions, reinforcing physical rehabilitation, promoting emotional expression, providing opportunities for autonomy, providing opportunities for positive, normal, and pleasant experiences, and improving the ability to participate in and attend to music activities. And the acute phase is mainly emergency management and treatment at the moment of injury. The rehabilitation phase is the most physically rigorous because therapy begins after the patient's skin is fully covered and the child is discharged from the ICU. And here, music therapists reinforce exercise and functional range of motion, promote adjustment to hospitalization and injury, decrease pain and anxiety related to rehabilitation, increase patient motivation and compliance and recovery, encourage a positive outlet for emotional expression, enhance caregiver-child interaction, provide developmental and neurological stimulation, and provide normalized experiences through music and play. And lastly, there's the reconstructive phase. And in this, music therapists help with coping with preoperative anxiety, encourage positive body image and self-concept, provide stimulation for developmental growth, improve quality of life, provide support for procedures, facilitate expression and validation of feelings, promote socialization and mastery over the environment, reinforce post-surgery range of motion and functional movement, improve pain management, and foster support among families and patients. Now let's turn our attention to the adult medical setting, first starting with obstetrics. So some common goal areas you see are physical needs, such as decreasing pain, reducing tension, physical comfort, and increasing movement. There's also emotional needs, such as improving a sense of security, decreasing anxiety, improving cognitive focus, emotional comfort, mental focus, and bonding. And some specific interventions used include, like an example is autogenic relaxation. And this is a technique that has patients visualize relaxing the suggested part of the body, and it's helpful to guide an antepartum patient to a more relaxed state. It's important to never use progressive muscle relaxation with this population due to the tightening and loosening of the muscles, and this could potentially be dangerous to the mother and the fetus. Now let's look at the intensive care unit. And people may be in the ICU for a variety of reasons, including complications from a surgery, antepartum or postpartum complications, disease processes, or cardiothoracic postoperative care. So there are three main experiences in the ICU. There's the physical experiences that could include things like breathing issues and associated distress, pain, altered states of consciousness, or unstable physiologic functions of blood pressure, heart rate, respiration rate, and oxygen saturation rates. There can also be emotional experiences such as feelings of dread, loss of autonomy and control, a sense of insecurity and vulnerability, anxiety, apprehension, despair, a sense of paralyzed will, grief, concern and worry, hopelessness, agitation, anger, depression, and aggression. Lastly, there could be spiritual experiences, which include an increased awareness of spiritual beliefs and needs, questioning faiths, feelings of abandonment, alienation, anticipatory grief and loss, and search for comfort, hope, and meaning. In the ICU, there's a common goal is to provide psychosocial and spiritual support to patients and their family members through family and individualized music therapy sessions. But above all, what we as music therapists do is support patients and their families in a holistic sense through their time in the ICU, no matter how brief or how long. In terms of common music therapy interventions, first is using relaxation supported by music therapist instrumental accompaniment. There's also music-based imagery, music as an alternate engagement, music-based relaxation supported by recorded music, therapeutic singing, active music listening, music with deep breathing, song phrase cued response, sound of family together music program. This in particular is where a grandchild or child can record their voice on GarageBand, and the music tracks are laid over the vocal tracks to create musical phrasing. The child chooses the content of the track with the help from the music therapist, and the child uses it to write original songs for the hospitalized family members, piggyback songwriting, and so on. And there's therapeutic instrument playing. Now let's think about the general medical and surgical report. Here, the common specialty units are internal medicine, which deals with non-surgical treatment of diseases in adults. This includes cardiology, endocrinology, infectious disease, gastroenterology, pulmonology, nephrology, and rheumatology. There's also the post-surgical, neurology, orthopedics, and burn areas. In terms of common goal areas, it's to decrease anxiety, decrease the perception of pain, improve mood and reduce depression, provide procedural and pre-procedural support, provide socio-emotional support, improve multisensory experiences, increase compliance and motivation with rehabilitation or treatment regimen, improve satisfaction of hospital stay, this is when it's inpatient, and improve physiological outcomes, such as respiratory rate, oxygen saturation rates, heart rate and blood pressure, and overall improve quality of life. When working with individuals with cancer, this is when the person's own cells attempt to destroy themselves. So differentiated body cells experience uncontrolled reproduction, which results in a loss of normal cell characteristics, regulations, and functions. The abnormal cells can destroy nearby tissue and metastasize or spread through the lymphatic system or bloodstream to other parts of the body. So cancer patients are receptive to music therapy when undergoing diagnostic testing, making treatment decisions when they're recently diagnosed, at the beginning of the post-treatment and survivor phase, before or during treatments that can lead to adverse symptoms, especially with radiation therapy and chemotherapy, in the palliative care phase, or when they're experiencing advanced recurrence, disease, or a shift in their treatment paradigm. And live music has been shown to improve immune system functioning and improves mood states, as well as vigor, relaxation, self-expression, and reduce stress, boredom, and anxiety. In terms of common music therapy treatment approaches, it's cognitive behavioral methods, Bonney method of guided imagery and music therapy as Malou, improvisation-based methods, music-based collage, medical music therapy, life review, musically supported counseling, psychodynamic music therapy, physioacoustic therapy, receptive approaches, psychospiritual music therapy, and songwriting such as piggybacking or songwriting. There's also eclectic music therapy to treat grief and loss. So thank you so much for joining me today. I look forward to seeing you next time.